Escherichia coli E. coli O157 is a strain of the bacterium E. coli that is particularly dangerous and can cause severe illness in humans. While E. coli is commonly found in the intestines of healthy people and animals, and most strains are harmless or even beneficial, the O157 strain produces a powerful toxin known as Escherichia toxin, which can cause serious gastrointestinal symptoms and even life-threatening complications. How is E. coli O157 transmitted? E. coli O157 is primarily transmitted through ingestion of contaminated food, water, or contact with animals. The most common sources of infection include undercooked ground beef, the most well-known source, especially hamburgers, as ground beef can become contaminated during slaughter. Unpasteurized milk and dairy products. These products can harbor bacteria if they are not heat-treated. Contaminated vegetables, leafy greens and other produce can become contaminated through exposure to contaminated water or animal waste. Unpasteurized juices or cider. These can contain the bacteria if not treated or processed properly. Contaminated water. Drinking or swimming in water that has been contaminated with E. coli can cause infection. Person-to-person contact. Poor hand hygiene, especially after using the bathroom or changing diapers, can spread the bacteria. Symptoms of E. coli O157 infection. Symptoms usually begin 3 to 4 days after exposure but can start anywhere from 1 to 10 days after ingestion of the bacteria. The severity of symptoms varies, but common symptoms include severe abdominal cramps. Painful stomach cramps are a hallmark of the infection. Diarrhea, often starting as watery diarrhea but quickly progressing to bloody diarrhea. Nausea and vomiting. Some people may experience vomiting. Low-grade fever, in some cases, but fever is not always present. In most healthy individuals, the infection resolves within 5 to 7 days without the need for medical intervention, but some individuals develop severe complications. Complications. The most serious complication associated with E. coli O157 infection is hemolytic uremic syndrome (HUS), which affects about 5 to 10% of those infected, particularly young children, the elderly, and people with weakened immune systems. Hemolytic uremic syndrome (HUS) is a potentially life-threatening condition that can develop a week after the diarrhea starts. It is characterized by hemolysis, the destruction of red blood cells. Kidney failure. The damaged red blood cells clog the kidney's filtering system, leading to acute kidney injury. Low platelet count. This can result in bleeding problems. Symptoms of HUS include reduced urine output, fatigue, pale skin, and unexplained bruising or bleeding. Immediate medical attention is required if HUS is suspected. Diagnosis. E. coli O157 infection is diagnosed through laboratory tests, specifically by testing a stool sample for the presence of the bacterium or its toxins. The test may specifically look for the Escherichia toxin produced by E. coli O157. Treatment. For most people, the treatment for E. coli O157 infection involves supportive care, which includes hydration. Drinking plenty of fluids to prevent dehydration due to diarrhea is essential. Avoid antidiarrheal medications. These can slow down the digestive system and may worsen the infection. No antibiotics. Antibiotics are not recommended because they can increase the release of Escherichia toxin and worsen the infection. They can also raise the risk of developing HUS. For severe cases, particularly if HUS develops, hospitalization may be necessary. In HUS cases, treatments may include intravenous fluids, to maintain hydration and electrolyte balance. Blood transfusions, to replace damaged red blood cells. Dialysis. In cases of kidney failure, dialysis may be needed to support kidney function. Prevention. Preventing E. coli O157 infection largely revolves around proper food handling, cooking, and hygiene practices. Cook meat thoroughly, Ensure ground beef and other meats are cooked to a safe internal temperature of at least 160 degrees F 71 degrees C. Avoid cross-contamination. Use separate cutting boards and utensils for raw meat and other foods. Wash produce thoroughly. Clean fruits and vegetables under running water before eating, especially those that will be eaten raw. Drink pasteurized products. Avoid unpasteurized milk, juice, and other products. Practice good hand hygiene. Wash hands thoroughly with soap and water after using the bathroom, handling raw meat, or coming into contact with animals. Conclusion: E. coli O157 is a serious strain of E. coli that can lead to severe gastrointestinal illness and complications such as hemolytic uremic syndrome (HUS). While most infections resolve without treatment, some cases can be life-threatening, particularly in vulnerable populations. Preventive measures, such as proper cooking, food handling, and hand hygiene, are key to reducing the risk of infection.